Hi, my name is Francesca, and I'm a clinical mental health counseling intern with Malloy's Mental Health and Wellness Center. I am also a drama therapist in training with the North American Drama Therapy Association. So there are a few people in the program here at Malloy that are actively training to become drama therapists as well. We wanted to share a little bit about what that means. It might not sound very familiar to you, but you might have heard of some of the sister creative arts therapies of drama therapy, such as art therapy, music therapy, dance movement therapy, or the expressive arts therapies in general. So, what is drama therapy? Here's a formal definition. Drama therapy is the intentional use of drama and theater processes to help clients make emotional, psychological, and behavioral changes. So, what does that mean? Some of us may have found ourselves looking in front of a mirror, practicing before some sort of big event, a job interview, or even just an important conversation with someone. We sort of intrinsically know that if we practice something first, we may be more successful in doing that same thing outside of our own private space. You also may have, gone to see a movie or theater or read a book and felt like you had a really strong connection with one of the characters, or maybe even had a strong emotional reaction. We know that this stuff happens. Life can be looked at as one big drama where people are playing different roles, different characters in different scenes. So we use these ideas that people already know about, like role, metaphor, story, and play to support clients in creating change. So you might be wondering, does this mean that I have to act or perform if I'm going to be using drama therapy? Not necessarily. So drama therapy exists on a continuum. On one side, we have clinical work, where drama therapists might be working in a hospital or in a treatment center. And on the other side, we have community-based work, might be social advocacy work, or working in schools or different community programs. Sometimes drama therapy does include different types of performances, but here's where it differs. The focus in drama therapy lies in the therapeutic benefits to be gained by the creative process, which all culminates in a final performance. So it's about the entire journey and the destination, showing what has been learned over that time. But the focus is not just on the final performance, but really what is being gained through that entire process. So you might wonder, what would using drama therapy look like in a session? It can look like so many things. It's active, it's experiential. We're using these core elements of drama and theater to create this change. If you're familiar with talk therapy, you know that the clinician might ask you a question and you might respond. And if I were to incorporate drama therapy into that exchange, it might look a little bit like perhaps you telling me something that happened with your mother, and rather than me listening to you tell this story in past tense, we bring it into the room in the present and we role play, right? I'm going to be your mother, or we can put your mother over here in sort of an empty chair, and you can dialogue with her that way. This helps give clients some closure and a sense of what it would be like to say something different or to practice a behavioral change in the moment. So you also might be wondering, what is this embodied piece? Why do I need to incorporate the body? Using embodiment with drama therapist results in a deep encounter with this personal material that the client is bringing in. When we give attention to the body, we are focusing on the ways that the body communicates things that are going on in these unconscious levels. So in other words, we're not just talking heads. We don't go through life only encountering things with our mind. We go through life encountering things with our mind and body, our whole self. So when you feel anxious or excited, you might feel that in your stomach, or you might feel that in your chest. You don't just think, oh, I feel anxious or excited. So when we incorporate the body, we have more access to what might be going on. Thank you for listening. This is a little bit about drama therapy. If you're curious or you want to hear more, I can direct you to the North American Drama Therapy Association's website, nadta.org, or you can visit us at Malloy Mental Health and Wellness Center website. Thank you for listening.